We hope you are having a great day, friends. Hey, health, and specifically better health, is something a lot of us have on top of our resolutions list this year. And one way to start your year healthy is to schedule an appointment with your doctor or doctors. So today, as part of our Take Back Control of series, we are shining a spotlight on health. So to help us do that is Dr. Darren Haskell, the Chief Medical Officer at St. Luke's Hospital. Dr. Haskell, it's good to see you, sir.
It's great to see you too.
So right off the bat, for our friends who are watching, what is the one most important piece of health advice you have for our friends for this entire year?
Probably the key item is everybody's health is individual. Schedule an appointment with your doctor. If you don't have a primary care physician, get one. Go in, be seen, get some very basic things done to get your year started on the right note. The other thing you guys have talked about a lot today, exercise. We all need to move more. Use your phone, look at the step tracker, set a goal and stick to it.
Oh, I do, which is why I walk in circles at the end of the day to hit those steps. But it's different as we age. So let's start off for maybe some of our younger viewers, those in their 30s. Are there specific exams 30-year-olds up to 40-year-olds should be getting?
Absolutely. Beginning in your 30s, you really do want to get in to see your primary care doctor. Some very simple, straightforward tests can really start to make an early impact on your health. You want to go in and get your weight checked, get your blood pressure checked, get some basic labs, figure out where your blood sugar sits, what your cholesterol numbers look like. It also gives you a chance to sit down with a health professional and talk about any mental health challenges you've had. You can be screened for any substance abuse issues. For our female patients, you do need to be going in and getting your pap smears, pelvic exams taken care of. Depending on individual risk factors, screening for other sexually transmitted infections. So there's a lot that's going on even as early as the 30s that really should be attended to.
Let's move up to 40s. What exams should 40-year-olds be?
So in the 40s, we're talking about a lot of those same items, but this is also the age range where we start adding some screenings for cancers. Specifically colon cancer, mammograms for breast cancer screening become very important in this age range. So we all should be getting engaged in that process on a regular basis in our 40s.
And then 50s and above.
Yeah. 50s and above, all those same things that we were talking about earlier still going on, but in your 50s is where we then also start adding, we're getting close to menopause, maybe it's time to look at the bone density. For people who've had a history of smoking, we got to start doing our lung cancer screenings. So there's a lot of things that get layered on decade by decade, and as we get well past that 50 mark, you know, there's a time where we have to start thinking about our cognitive health, getting our gait assessed, doing those types of things to think about preventing a problem before it occurs. The real key is primary prevention. In medical terms, we define that as intervening in the disease process before the patient is symptomatic. That's where we have our best chance of making a big impact in your lifelong health.
Then I think that's exactly what all of us want. Good to see you, sir. Thank you.
Great to see you.
And you can find this segment on firstalertford.com/greatday following the show. Kent, it all starts with that first conversation with your primary care doctor, or if you don't have one, finding one.
And you know, I just had my annual physical with Dr. Wiedner last week, and I found it interesting. He measured me for a casket. Is that, at my age, is that unusual, Dr. Haskell, or?
That's a little outside the standard practice.
Right.
I'd wonder what else he found.
Don't badmouth him. I'm not asking you to badmouth him. I'm just saying it felt a little weird.
Yes.
Thank you both.
Take it away.
Okay.